NASHAT, Syphilis Masterclass, The Great Imitator Unmasked. Welcome to the Syphilis Masterclass. Today we're unmasking one of the oldest, cleverest, and most slippery STIs out there, syphilis. It's often called the Great Imitator because it can look like just about anything, or nothing at all. But don't worry, you're about to become a detective skilled at spotting, treating, and stopping Treponema pallidum in its tracks. Meet the microbe, Treponema pallidum. This is no ordinary bacteria. Treponema pallidum is a spirochete. That's a long, skinny, corkscrew-shaped bacterium. It's got moves like Jagger and drills into skin and mucous membranes using its twisty body. You won't see it on a regular gram stain. You'll need dark field microscopy or a special stain to spot this slippery snake. And it can infect any part of the body: skin, brain, eyes, bones, even blood vessels. Left untreated, it progresses through stages, each more dramatic than the last. How it spreads: not so innocent encounters. Syphilis spreads primarily through sex: vaginal, anal, or oral. It also crosses the placenta, causing congenital syphilis, a devastating but preventable condition. You can't get syphilis from toilet seats, doorknobs, or sharing food, but you can get it from direct contact with a sore, even when it's hidden in the mouth, genitals, or anus. Clinical drama: syphilis in 4 acts. Syphilis loves drama. It comes in 4 acts or stages, each with its own twist. 1. Primary syphilis, the silent sore, starts with a chancre, a firm, painless ulcer where the bacterium entered, appears about 3 weeks after exposure. Found on genitals, anus, lips, tongue, or fingers. Painless, people often don't notice, heals in 3 to 6 weeks, even without treatment. But don't be fooled, it doesn't mean the infection is gone. It just means it's about to level up. Secondary syphilis, the great mimic. About 4 to 10 weeks later, the bacteria spread through the bloodstream. Symptoms may include skin rashes, often on palms and soles, condylomata lata, wart-like moist lesions in genital or anal areas, patchy hair loss, fever, swollen lymph nodes, sore throat, malaise. Rash can be faint, itchy, or missed completely. Without treatment, symptoms resolve, but syphilis doesn't. 3. Latent syphilis, the quiet creeper. This is the no news is not good news stage. There are no symptoms, but lab tests remain positive. Early latent equals 1 year since infection, still infectious. Late latent, 1 year, not sexually infectious, but still dangerous. Left untreated, 1/3 of people will go on to the final, most severe stage. 4. Tertiary syphilis, the long game. Years, even decades after the initial infection, syphilis can resurface with a vengeance. Gummas, soft, tumor-like growths that destroy skin, bone, or organs. Cardiovascular syphilis affects the aorta, leading to aneurysms. Neurosyphilis invades the brain or spinal cord, causing memory loss, dementia, or paralysis. This stage can be fatal, but it's 100% preventable with early diagnosis and treatment. Special syndromes when syphilis goes rogue: ocular syphilis, blurry vision, eye pain, or even blindness. Otitic syphilis, hearing loss, ringing in ears. Neurosyphilis can occur at any stage, not just tertiary. Always consider syphilis an unexplained eye, ear, or neurosymptoms, especially in people at risk. Congenital syphilis, pass before birth. If a pregnant person has untreated syphilis, the baby can be infected in the womb. This can lead to miscarriage or stillbirth, deformed bones, meningitis, rash or nasal discharge, snuffles, developmental delays. Good news: congenital syphilis is preventable with early screening and treatment in pregnancy. Diagnosis: how we unmask the imitator. Syphilis testing has 2 parts. Now 1. Non-treponemal tests, examples, RPR-VDRL, used for screening and monitoring treatment. Titers drop after successful treatment. 2. Treponemal tests, examples, TPA-ABS, EIA, used to confirm diagnosis. Stay positive for life. Some countries use reverse sequence testing, starting with treponemal tests first. Also test for HIV, common co-infection, hepatitis B and C, pregnancy, if applicable. Treatment: simple, effective, timeless. No fancy pills or combos needed. The old stuff still works. First-line treatment for most adults: benzathine penicillin G 2.4 million units IM in a single dose. Early syphilis, primary, secondary, early latent. just one dose. Late latent or unknown duration, once weekly for 3 weeks. Neurosyphilis or ocular syphilis, aqueous crystalline penicillin G IV for 10 to 14 days. Penicillin allergy, doxycycline, tetracycline, or ceftriaxone may be used for some stages, but not in pregnancy or neurosyphilis. Pregnant patients must undergo penicillin desensitization. Follow-up, stay on track. Repeat non-treponemal titers RPR at 3, 6, 12 months. Expect a 4-fold decline in titer within 6 to 12 months. Monitor longer for HIV plus patients or those with late syphilis. If titers don't fall or symptoms recur, consider treatment failure or reinfection. Partner notification and treatment. Anyone exposed within 90 days of the patient's diagnosis, treat empirically. If 90 days ago, test if results are pending. Abstain from sex for 7 days after treatment and until partners are treated. Counseling. Teach, don't just treat. What to tell your clients. Syphilis can be silent, but still dangerous. Treatment stops progression, but doesn't undo damage. Use condoms and get tested regularly. HIV and syphilis often travel together. Get tested for both. Come back for follow-up labs. Tell your partners your health protects theirs. Quick recap. Syphilis is a sneaky multi-stage STI caused by Treponema pallidum. Primary, painless sore. Secondary, body rash, wart-like lesions, systemic symptoms. Latent, quiet, but still active. Tertiary, brain, heart, or organ damage. Diagnosis equals RPR-VDRL plus treponemal test. Treatment equals penicillin. Follow-up is key. Prevent congenital syphilis through early screening and pregnancy. Teach, test, and treat to stop the spread. That's it. You just conquered the great imitator. From the silent chancre to the screaming aorta, from painless lesions to powerful prevention, you're now ready to diagnose, treat, and protect against syphilis with confidence. Because in public health, catching the quiet ones saves the most lives. The end. Let me know if you'd like this turned